Could you just give me some idea of your job and your experience, please?
Yes, certainly, Mark. I'm a consultant respiratory physician at the Royal Hallamshire Hospital in Sheffield, sort of industrial heartland of the UK. And I also work as the Chief Medical Officer at the Health and Safety Laboratory, also a reader in medicine at the University of Sheffield, so I've got a rather odd, complicated job. Right. My experience dates from training in medicine in Manchester in the early 80s. I qualified in 85. And since that time, I've always had a major enthusiasm for chest problems or respiratory disease.
So in your experience, do you find that people get missed, as it were? They've been to their GP, he or she has said, well, yes, you seem to have got asthma, and they give them treatment, but it takes some time to get that connection.
We've relatively recently finished a study in the United Kingdom looking at this very point. In other words, if you are a worker working as a spray painter and you get symptoms of wheeze or shortness of breath, you go and see your family doctor. How long does it take a person like that to get to an appropriate hospital specialist? And we looked at about 100 cases of people nationally with possible occupational asthma. And the average was about 2 or 3 years. But there were some stars out at 28 years. Wow. So there are major delays for certain individuals in the system. And of course, if those people are continuing to expose themselves in the work environment, that can be doing much more harm.
Right. And what happens to patients with occupational asthma, in your experience? I mean, you see them sometimes quite late in the day, I guess, and others are picked up earlier in the day when their symptoms are relatively mild. Could you give us some idea of what happens to them?
Well, to give you an example, I saw a case a few months ago of a worker working in a food processing plant who had become so unwell on night shift that he had to be dragged out of the workplace by his colleagues, desperately ill with asthma, never previously been diagnosed, almost died and had to be taken to hospital. It was only about a few months later that the penny dropped that this gent had been working with prawns, and prawn meat itself can cause allergy and asthma. Now, I'm not saying that most people with occupational asthma almost die, but asthma is a serious condition. If people continue to expose themselves, like this gent I've just talked about, it could have caused him fatal or exceedingly severe asthma if it was not picked up. Okay. Thankfully for most people, the situation is a bit clearer. If you continue to expose yourself, you are likely to have troublesome continuing asthma symptoms. If you stop exposure, in other words, you're a spray painter, the diagnosis is made, and you retrain and don't expose yourself to paints, about a third of those individuals, even though they're not now exposing themselves, will get worse. About a third will stay the same, and about a third will improve. So the bottom line is it's a serious problem, and reducing or stopping exposure doesn't always cure people.
Occupational health surveillance. People exposed to asthmagens should be under occupational health surveillance. What's your views on what's good occupational health surveillance? Can you give me an example of where it's worked?
Occupational health surveillance is very important for watching groups of workers who may be exposed to agents that could cause asthma. For those who are unaware about what occupational health surveillance is, it may be a nurse or a doctor seeing each individual within a workforce, for example, a spray painting garage, every year, to ask them a very brief set of questions about their breathing and perhaps also take some measurements of their breathing test. I think good practice for individuals who are exposed to asthmagens in the workplace is to be seen at least yearly. And this could be by a responsible person such as a nurse or a physician. Normally in the workplace this will be a nurse or an occupational health provider. At that meeting, the worker would be allowed to talk about breathing problems, and hopefully in most cases that's going to be very quick because there won't be any. But as you make the point in the question, if there are early beginnings of asthma, it is best to pick it up in that environment rather than wait for acute asthma or bad asthma to occur. I would also think breathing tests are important every year as well for individuals who are exposed to known asthmagens.
You get compensation based on disablement and how that disablement is judged. So, for instance, at the moment it's about £70 a week if you're 50% disabled. What does 50% disabled mean if you're an asthmatic?
Well, asthma's very variable condition, so we have to take that into account when we're calculating disability. For example, asthma may be very troublesome to a worker on one day, but on another day they may just be absolutely fine. So patients can be very disabled on one day and not disabled at all on another. So my comments relate to a sort of average over a period of time.
Right.
50% disablement would generally imply quite significant shortness of breath. To give you an example, climbing a flight of stairs would be difficult. Walking around a supermarket, even without pushing a trolley, would be difficult. And you wouldn't be able to keep up with people of your own age on level ground when walking. You might even have to stop, even at your own pace, on level ground when walking at that level of disability. So that's quite marked.
It's quite marked, and you're quite disabled by it then?
Absolutely, and of course that's what I am sure why the DSS has drawn a line at that point in terms of disability, or in terms of what you're describing in terms of money income, because of the fact that it is really quite marked impact. It has a marked impact on your life.
Okay.